The cardiac box in trauma. The cardiac box was historically used to identify patients that required a pericardial window. Contents of the cardiac box includes lungs, great vessels, aortic arch W, branches, and subclavian vessels, trachea into bronchial system, heart plus pericardium, esophagus, and the diaphragm. Deadly injury patterns: tension pneumothorax, kills from obstructive shock, difficulty with ventilation, lost preload, and circulatory collapse. Increased respiratory distress JVD, decreased breath sounds, or tracheal deviation can be seen. Treatments include chest seals, needle decompressions, chest tubes. Great vessel injury. Penetrating injury, or significant blunt force with shearing energy. Classically massive bleeding with hemorrhagic shock. Typically needs chest thoracotomy. In thoracic trauma, the thoracic aorta is the most commonly injured vessel. Tracheal injury. With tracheal injuries, you may also see signs of pneumothorax, respiratory distress, crepitus around neck, chest, definitely airways, surgical exploration, or bronch needed. Cardiac tamponade. Fluid into pericardial sac, preventing diastolic refilling of the heart. Also, obstructive shock. Beck's triad equals hypotension. JVD. Distant, absent heart sounds. May see electrical alternans on ECG. Preload dependent. Treatment is pericardiocentesis, pericardial window, or chest thoracotomy. Esophageal rupture. More difficult to diagnose. May not be immediately life-threatening, but needs to be considered. Surgical repair. Risk of mediastinitis, with extremely high associated mortality if missed. Diaphragmatic rupture. Varying degree of significance. Also highly missed during initial trauma workups and can be difficult to diagnose. Typically needs surgical exploration. More common on left side, liver protects right side. Risk of seeing gastric bubble, intestines W, air into chest cavity, and mistakenly placing chest tubes into them. Subscribe to the channel for more.